A cervical check is when your provider will place their fingers inside to check a few things. How dilated you are, what station baby is at in your pelvis, if you're soft, and if you're thinning at all. These things can be indications that labor is near, but it also can mean that labor is still far off. This is why some women may opt out of cervical checks at their doctor's appointments. When you go into labor and you are having consistent contractions, they will typically use the cervical check as a baseline and check you in a couple hours after you've been having consistent contractions to make sure that these contractions are actually progressing dilation of your cervix. You can decline these or limit them during labor, but they will need to check at some point to make sure that these contractions are dilating your cervix. Other things to know about a cervical check is it can be pretty uncomfortable, especially if your cervix is still high up and you're very, very closed and not effaced at all. It can also cause some light spotting for a day or two, so just keep that in mind if you are choosing to get a cervical check.